presentation of the report learning from the Gambia's response to COVID-19 and its impact on marginalized groups, lessons, successes and challenges was done by Westminster Foundation for Democracy and the British High Commission at the premises of the British High Commissioner's office on Monday.
What we did was to hold 3 separate discussions, consultations with the various groups. On one side is the persons with disabilities from the various organizations that they constitute. We had representatives from there, and at a time actually when in fact public gathering was more or less still restricted in the Gambia. So that was one consultation we had to do online, virtually. But the second consultation was with the women's rights organizations in the civil society. And then the third separate consultation we had was with the National Assembly and government representatives, particularly those relevant institutions, health, education, Ministry of Trade, Ministry for Women's Affairs. What we did was eventually to gather all of the issues, the discussions that we've had into a report, because we felt the report is important. It is important to gather all these conversations, put it in a report, which could be a resource, a tool, not just for government, but for all of us, for all stakeholders.
President of the Gambia Federation of the Disabled, Magistrate Klubali, was present at the event.
This conversation was so interactive, coming from different persons with disabilities, because we have the feelings that usually during difficult times or moments, persons with disabilities are always considered as the most vulnerable and the most disadvantaged. That would always be the last to receive at least emergency, let's say, response.
President of the Female Lawyers Association of the Gambia has this to say.
COVID affected everybody, but it affected women and children the most. I'm sorry, but I'm very passionate about what I'm saying. You had women who were pregnant, who couldn't go to the hospitals because everybody was afraid and told that you would catch COVID when you get to the hospital. Women already give birth at home, but it increased. Then what did we hear? A lot of death happened. Babies were dying because they didn't have the facility that they needed. I asked around my neighborhood, all the women there, nobody got food distribution. Where did it go? It goes back to where we say we need to have structures in place that would assist women and children. We need to. Government needs to listen to us. We have a ministry. Things should go through the ministry to get to women. But it doesn't.
The British High Commissioner David Belgrove congratulated all participants but was quick to urge all to learn from the report and put it into good use.
We learn the lessons. As somebody said, everybody makes mistakes, but only a fool refuses to learn from them. I was in Liberia during the Ebola outbreak, and I was also in Liberia when this pandemic came along. And, I was disappointed of how many lessons we'd learned during Ebola, which everybody had forgotten. And, reports had been made and people had forgotten many of the important lessons we learned during that time. So one of my pleas to you is don't forget this report. This won't be the first crisis we find, and many of the lessons learned, particularly as it pertains to women, to people with disabilities, to children, are applicable in many other circumstances, including day-to-day life.
The report covers information on how certain groups of persons did not get access to new education programs, how information on COVID-19 did not reach to persons with disability, negative effect of public emergency on persons with disability, police harassment of women market traders, access to healthcare challenges, maternal death, and a lot other challenges faced by vulnerable groups. Fatu Kamara reporting for the Fatu Network News Review.